Thank you very much, Dr. Reagan. It's really good to see you again. I've missed you. What you did not say in my bio is this, that my name is Mike Barron and I am an alcoholic. I'm a recovering alcoholic with 21 years of sobriety. In terms of addiction, my story is pretty common. Addiction runs rampant in my family of origin. I've lost a brother to addiction. I have a sister on buprenorphine. My father died an active alcoholic. My alcohol and drug use started around ninth grade as binge drinking and smoking weed on the weekends and progressed quickly. My family house was not a safe place growing up. Knowing what I know now, I graduated high school with a high adverse childhood experience or ACE score, and I met the DSM criteria for alcohol use disorder and other disorders. The alcohol and the drug use increased until I was intervened on. Somehow, I never had a DUI or any legal problems. I never had any license problems. On the outside, I looked like a choir boy, and we looked like the all-American family. On the inside, I was dying. I had created a living hell for myself with no exit that I could see. In the last years of my active addiction, everyone knew there was a problem. The alcohol and the drugs quit working. They quit numbing the pain that I was trying to anesthetize. At that point, I wasn't using to get high. I was using just to get out of bed, to get back to my new level of normal, my new hell. My brain was completely hijacked, and I was in complete and constant despair. My recovery started at age 39, when Dr. David Dodd intervened on me and really saved my life. Dr. Dodd was a general surgeon from Murfreesboro and was the first full-time medical director of the Tennessee Medical Foundation Physician Health Program. He came to my office one Friday afternoon in a prearranged meeting, only I didn't know there was a scheduled meeting. At that time, I was a practicing pediatric cardiac anesthesiologist. The first time I met Dr. Dodd, he was a gentleman, and I wasn't. I was arrogant, angry, and I wouldn't disclose anything. That was all driven by my fear. I was scared I'd lose my medical license if I got help. I didn't know what the TMF was or what they did. I was literally afraid that I was going to die and more afraid that I wouldn't die. The fear and the shame just perpetuated the alcohol and drug use. I was in a downward spiral. I had pushed everyone away that was wanting to help, including my wife. I didn't see a way out to stop the alcohol or the drug use. I did not have a solution. A month later, unbeknownst to me, Dr. Dodd met with my wife. His advice to her was to make sure that the life insurance was paid up and to go to Al-Anon. She did that and hired a divorce lawyer. A few weeks after that, he came back to my office again unannounced. This time I had what's called a moment of clarity, and I listened, and he literally saved my life. The way that Dr. Dodd intervened on me was perfect. Rather than tell me what was wrong or what I need to do, he simply told me his own story with alcohol, his own reluctance to get help. Our stories and our lives were very similar. He opened my eyes to the fact that I wasn't alone, that I wasn't a morally corrupt and a horrible person. For the first time in years, I had a glimmer of hope. That evening, after Dr. Dodd and I met for about 2 hours, I went home. I thought I was going to make some grand announcement to my wife. After I told her all that happened that day and what has been going on for the last many years, her response to me was a classic Al-Anon response. She said, "It's your night to do the dishes." She wanted out of this relationship. I left for treatment the next morning. Treatment for me was magical. It was an education. I learned to accept the fact that I was an alcoholic. Prior to that, I thought people with addiction lived under a bridge and used needles. I never used a needle, and I never lived under the bridge. I had a family, a house, a good paying job. Most importantly, in treatment, I was introduced to other professionals that were just like me. For the first time in years, I wasn't alone and ashamed. Also in treatment, my underlying anxiety, depression, and childhood traumas were addressed. I spent 12 weeks in residential treatment. I didn't want to leave treatment because for the first time in my life, I felt safe. After treatment, I spent about 4 weeks at home before going back to work, getting used to my family and having them get used to me. I also used that time to transition my recovery program from the treatment center to home. I've always been very open about my recovery to my children. I have taken them to AA meetings and they know my complete story. Unfortunately, they inherited a genetic predisposition for addiction. Since I gave them the genetic risk, I want to give them the antidote as well, to let them know that if they ever had a problem with addiction, that recovery works. So far, knock on wood, they've escaped any problems with addiction. And just last month, on April 3rd, 2021, I walked my daughter, Megan, down the aisle for her wedding. That was a magical moment for us all. I've also been very open about my recovery to those outside my family. That openness helps to protect me, to remind me of what it was like, what happened, and what it's like now. It reduces the stigma of addiction, and it's a way for me to pay it forward. My recovery is job one. I can't be a husband, a father, a physician, or the medical director of the TMF Physician Health Program without my recovery. I was taught early on, whatever I put in front of my recovery, I will lose. So I still go to 2 or so 12-step meetings per week. I still go to the Nashville Caduceus meeting once per week. That's a meeting for healthcare professionals. We have 11 Caduceus meetings throughout Tennessee. When I left treatment, Dr. Dodd advised me to leave anesthesia, which I eventually did. At age 40, about 1 year after I went back to work, I walked out of work as an associate professor of anesthesiology, and a few months later, walked back in as a second-year psychiatry resident. That was one of the best and most humbling decisions I ever made. I followed that with more training in addiction medicine. As Dr. Reagan said, in 2006, I published original research that showed that high-dose opioid medications made chronic pain worse, basically demonstrated opioid-induced hyperalgesia syndrome. Soon after that, I found myself yelling at the top of my lungs the huge risk factors that were inherent to opioids. Unfortunately, the pharmaceutical firms had a louder voice. I was dismayed at how pharmaceutical greed propelled the opioid epidemic. Industry was dictating prescribing habits without evidence. I also learned at that time to be careful what you wish for. My prayers for a louder voice came to me when I was appointed in 2010 by Governor Bredesen to the Board of Medical Examiners and reappointed in 2015 by Governor Haslam. Now I was able to address the opioid overprescribing problem from a regulatory position. I was also able to educate other board members about physician health and wellness, including addiction. At that time, I was also appointed to the chair of the CSMD Oversight Committee for 3 years. The CSMD is one of the most powerful clinical tools to detect prescription diversion and overprescribing. I resigned those appointments in 2017 to take over as medical director of the Tennessee Medical Foundation Physician Health Program as the third full-time medical director. I am very proud of my recovery program. The stigma and shame of having addiction almost killed me. Unfortunately, addiction does kill a lot of people. I share my story in hopes that helps someone else get help. We still have an opioid overprescribing problem in the state. We have made significant progress at reducing prescribed opioids, but we're still above the national average for prescribed MMEs, and overdose rates are still increasing. When tobacco products are included, addiction is the leading cause of death and disability in this country. I'm a big proponent of treatment. I'm also the volunteer medical director of the Nashville-Davidson County Drug Court, or DC4. If we are going to decrease overdose rates, we need to provide treatment as an option. There are only 3 outcomes for addiction: locked up, covered up, or sober up. Addiction is a chronic, progressive, and lethal disease. It does not go away by itself. Treatment with accountability and monitoring saves lives. We know from the physician health programs and the HIMSS program for commercial airline pilots that 80 to 90% sobriety rates at 5 years are possible with appropriate treatment and wraparound services. My journey to date has been wonderful. My wife and I have been married for 34 years, and each year is better than the last. My children love me. The work I do is challenging. Physicians with addiction are shame-based. They don't transition to the patient role easily. They think they know what's best, and they are scared to get help for fear of losing their license. There is still an enormous amount of stigma to overcome, but the work is immensely gratifying and rewarding. Watching a physician get healthy and return to life like I did, to their family and to their work, is priceless. When they develop gratitude, then I know they are in solid recovery. I hope to talk more about the Tennessee Medical Foundation Physician Health Program later today. Thank you, Dr. Reagan, for inviting me and listening to my story.